Bismillahirrahmanirrahim. Assalamu alaikum students. At the level of nursing students, I will be very briefly describing you the labeling of normal ECG waves. Students, keep one thing in mind, that I am not going to enter the technicalities and graphical representations of ECG. I will tell you just labeling of normal ECG waves so that you can differentiate between a normal and an abnormal ECG when you are performing your ward to ward duties. Kindly give this camera to me so that I may focus on the written material. Students, here you can see this is graphical representation of ECG. What is ECG? ECG is recording of electrical activity of the heart on a graph paper. Students, all the ECG waves are positive waves. Means positive wave means they are located above the baseline. Students, this is the baseline. This is the baseline. All the waves are positive waves. They are located above the baseline except Q wave. And Q wave is not present normally. It is an abnormal pathological finding. So we start with first positive deflection. First positive wave in the ECG is P wave. Then we have got a small notch. It is the start of QRS complex. Students, when this notch goes below the baseline, it becomes Q wave, which is a negative wave. Normally, Q wave is not present in the ECG. Only a small notch is present here where my finger is located. Then we have a positive upward wave which is called R wave. This positive upward wave is called R wave. Students, this R wave is then followed by downward S wave. This is S wave. And this S wave is again followed by a positive T wave. Students, P wave represents depolarization of both atria. QRS complex, it represents ventricular depolarization. And T wave represents ventricular repolarization. Students, what is depolarization? Depolarization means a sudden rise in the action potential. And repolarization means decrease in that resting membrane potential. Students, here are some of the positive points to always be remembered. P wave represents the activation of right and left atria. QRS complex represents the simultaneous activation of right and left ventricles. But keep one thing in mind, that most part of QRS complex is because of musculature of left ventricle. Now there is another positive wave in the ECG which is not usually normally visible. This positive wave is called U wave. Student, U waves are more prominent in slow heart rate cases. Students, in normal ECG, R waves is smaller in lead V1 and V2, and it gradually increases in size up to lead V5. However, in V6, this R wave is smaller as compared to V5. I conclude from lead V1 to V5, the amplitude of R wave gradually increases. Students, S wave, they appear in V5 and V6, and they progress in size up to V2. It means S waves are reverse of the R wave. R wave increase in size from V1 to V5 leads. On the other hand, S wave progresses from V5 to V1. Normally, Q waves may be seen in lead V5 and V6. These are chest leads or precordial leads. Students, all the E.C.G waves are in reverse direction in the lead AVR, and this is another criteria to assess your performance of E.C.G. When all the waves are negatively deflected in AVR lead, it means you have correctly placed the E.C.G leads. If any wave is positive in the AVR lead, then it means that your placement of E.C.G leads is incorrect. So this was very brief about labeling of E.C.G waves. Thank you, students. Allah Hafiz. Students, this is a sample E.C.G. Here you can see different leads, lead 1, lead 2, lead 3. Here especially you can see AVR lead. In AVR lead, this is AVR lead. In AVR lead, students, you can well assess that all the waves are negatively deflected. You can well imagine the progression of R wave from here. We can see, yes, progression of R wave from V1 to V4, V5 and V6. This is normal phenomena. Progression of R wave from V2 to V6. This is graphical representation of electrocardiographic electrical activity of the heart. Thank you, students. Allah Hafiz.